a 26 years old boy who is otherwise perfectly healthy and he is working moderately built with a properly nutrition came with a just normal report showing that he is having fatty liver grade 1 to 2. He is very scared. Doc, I'm not taking any alcohol. I am not smoker. I usually go for a walk. But why I'm having this kind of fatty liver? And he is not alone. Out of 3 to 4 members, one of them is diagnosed with fatty liver in India, knowingly or unknowingly. Why? Because many of the time fatty liver doesn't have any symptoms until it is getting very late. Let us see what's the risk factor for that boy. When we asked, what is your work? So he is usually sitting at home, working from home, not much of a mobility. Second thing, I asked, when is your working time? So he is working in a night shift. So he is working in a night shift, sitting the whole daytime he is sleeping. What about the diet? Overnight he is consuming tea, coffee with sugar. Though he is taking maybe 1 or 2 million a day because he is not getting time, but he is continuously having tea, coffee. So that is what, so if we see how many risk factors are there for him. So he is not sleeping properly, his circadian rhythm is completely different, he is not taking meal properly, that means his protein content is less, and whenever we are taking tea, coffee along with some biscuits or something others, definitely we are increasing our glucose level. Simple sugar intake is increasing. So these are the reason he is getting more predisposed for fatty liver. Let us see what is fatty liver. By the name itself calls, when the fat molecule absorb and go inside the liver, it is called fatty liver. So fatty liver is having few stages. First step, when there will be a normal fatty liver, so that means the more than 5% of the liver will have fat accumulation, that will in the ultrasound will call it as a fatty liver. That is not harmful, it is reversible. When that fat goes to inflammation and it will start injuring our liver cells, that is when it is called steatohepatitis. So you will see in the blood test there is some biochemical markers called SGOT, SGPT that will be sometime raised. That is also reversible when from there it goes to the next stage. So this stage is fibrosis. When the cells will start becoming stiff, the liver cells will start becoming stiff. So that is when it will start becoming irreversible. And when slowly it goes to cirrhosis, that means the cells will start not to work, they will stop working. That's when it goes for cirrhosis. And many of the patients from cirrhosis will go to hepatocellular carcinoma or liver cancer. So this is the natural way. So if we can stop and reverse back before it started fibrosis, we will be absolutely fine. And it is very much done. Good point is, from starting from just storing of the fat cells in the liver till the fibrosis, it takes time. So if we can diagnose early and make it before, you can treat before or intervene before, we can treat it much better. How we are going to diagnose this? As I said, the symptoms are not much. Maximum it is asymptomatic. Sometimes with the blood test, we will get to know the enzymes are elevated. Sometimes some people can have right side of pain, right side of abdominal pain or heaviness. Sometimes some people may have little digestion issues. But other than that, usually in early stages it will be asymptomatic. Only we can know by doing an ultrasound. Now, how we can know that it is in the reversible stage or irreversible stage? For that we have to do something called fibroscan. Just to check that how much is the elasticity of the liver. If the elasticity of the liver is much more, so that means it is going to the fibrosis stage. That's when it is irreversible. So let's talk about the reversible part, when we can intervene. How we are going to intervene? First and foremost, if somebody is alcoholic and smoking, stop alcohol, stop smoking. Second thing, look at your diet. So many of the time it is happening because of high triglyceride. And high triglycerides not mean that if you remove your fat content from the food, then triglyceride will come down. Yes, you have to reduce your fat content, at the same time you have to reduce your simple sugar content like fruit juices content, carbonated drink content. Okay, all those things we have to reduce before. Third thing, we have to start walking. We have to start reducing our body weight. If we can reduce our body weight by 5%, the fatty liver will start getting reversible. If we can reduce the body weight by 7%, inflammation will become reverse. If we can reduce our body weight by 10%, even the early fibrosis stage can be also reversible. So weight loss is that important, and weight loss means not only fat loss, at the same time you have to gain our muscle. So strength training is also important. So if we can do aerobic exercise which will help for fat mobilization for around 150 to 300 minutes per week, and if we can do at least 2 to 3 sessions of 20 to 30 minutes of strength training in a week, will be very much better. And not only that will reverse the fatty liver, the insulin sensitivity also it will improve with that. Now next goes for, in case how you have to do for our sleep cycle. Try to make with your circadian rhythm. I know with the work and busy life it is very difficult, but try to sleep when the sun is not there. That means at the night time, and try to wake up early in the morning. And try to take your meal starting with the day and stop your meal when the day is finishing. So take early dinner. So these are the things which is going to prevent slowly. And if you have to do other blood tests also to see any other risk factors are there or not. So if you are diabetic or not, how is your glucose level, how is your heart condition. So all those things you have to check. So if somebody is female, if some female patient, for them you have to check your cycle is irregular or not. So that we have to see if they are having PCOS or PMS or not. So patients who are diabetic, pre-diabetic, hypertension, dyslipidemia, metabolic disorder, for those people, everybody we should screen for LFT, HbA1c and ultrasound to rule out any fatty liver. Thank you.